digitalization. It's a very good a transformation from what we are. Let's take an example. This is that digitalization is there in all vertical. Today we are going to talk about healthcare. What's the journey of our healthcare? In an age where a doctor and patient are being connected, information is stored in doctor's brain. There is no record, or it's in one-to-one communication, and doctor has a complete. It was possible because during that age we do not had major diseases, or there is the population level is less, and the need for a diagnosis etc. was also a minimal. Coming back to the next stage, that where probably 10 years before we were in the document age, where all are being paper-based records stored stored and maintained in the hospital. Now we are currently in a digital age, where everyone is talking about personalized information. So moving towards in digitalization, that's a huge domain to talk about, considering the time and other speakers effort to continue in the next very limited time. We will focus on 7 key area of digitalization. What are the key important area that we need to focus on? Capture and store record. Can we completely move, not just in a corporate sector plus also in the public sector, move from a record on a paper based to a digital based? Can we get towards the rural by which a specialist and doctor can be connected through an integrated telemetric devices? And teleconsultation or saying communication, it's not just a video conferencing, can be a teleconnect, but can doctor and patient and the healthcare provider, can they connect each other and do? In the central pillar of which both towards the framework and this information, because in the right hand side all this is talking about an input, whereas in the left hand side it's a framework. In between plays a very important vital role is data security, which everyone asks for. So that is another area that is also required to be more digitalized. In a lot of other technologies available. In the upcoming slide we will talk about it. There should be a standard process and policy, thanks to India government that has helped release telemedicine, and there are upcoming policies are on its way. A framework which can not just for one application, a framework by which a platform where there are different applications, can be a mobile app, starting from mobile app till your inpatient record. Can this all be at one accessible area? Thanks to again government for bringing up and releasing a national digital health mission by which a blueprint is ready, and everyone in the health sector can also now get into this mode and digitalize. And there is a common healthcare representation layer. Like there are more about some right now after this pandemic, COVID has given us a push to the digital. Rather, there are a lot of memes going on in the in the LinkedIn. Who pushed the digitalization? Is the CEO? Actually, they are saying no. COVID has pushed digitalization, right? So we have now got a put throttle now, and everyone in this industry, at least from last 2 months, we are about minimum to 400 to 500 telemedicine, right? Just in one sector, we have 400 to 500 telemedicine applications are evolving. Coming back to our technology, we have data, and of course, data is an information, but can it become a wisdom? Is it really necessary to a population like India? True, we need to do that. For that, there is a platform. There are certain other technologies available. You name it, start from big data, augmentation. Telemedicine is one of a solution by which we can get a lot of inflow and make sure the reach has created reach can be made easy. Lot of innovation in advanced medical equipment. One of our friends Sushil in this panel is going to talk about it. Of course, everyone knows right now, from a small baby till an on CEO talks about AI, because all we wanted is, can I have all this data right now? Can I convert that into a wisdom? Can be for the doctor or for the patient, right? And then of course we need to have a big store data, because as a policy in India, healthcare as data has to be stored within India. Blockchain, a good platform, an upcoming scaling platform for our security. Overall, an application layer. Can we have an integrated or an application layer which can help convert the information to a wisdom? Because right now we are in the information age. Enough number of data is available. You Google, you get all this information, but this is really necessary. This information, is it valid for me? Is it unique for me? That is where all this technology can put together and give a wisdom to a patient and to the doctor and for the radiologist or other health care provider. The last slide that I want to present, always Tata, thanks to Tata Group, and everyone knows about all the familiar figures here, which I don't wanted to present, and you know about Tata. What Tata has adapted from my point of view is they always see technology as not just a bit of hardware, right? They see the technology as a method to solve the problem and can be the pillar for future. That's where they started from a one small unit, and that becomes now a Tata group, which can serve and be to the humanity and be a trustworthy product and provide a solution. With this three, right, mantra, Tata, what about Gloheal, which is Gloheal is a telemedicine product from Tatacom, which is going to connect, which is already connected few rural places, connected few patients as doctor, made life easier from last 4 years. But right now our focus has scaled up. Maybe we work with government and private sector to ensure a framework which can interposes the solution, captures, have an light EMR HA on a cloud, a communication between patient and doctor can be effective, and make more work with more partners to ensure that this healthcare is taken to the rural place and be at the pocket of all the patients. Thank you so much. If there is any questions I would like to take, or I'll leave it to the next speaker.